And so good afternoon, everybody. Welcome to the Housing and Harm Reduction session for the State Harm Reduction Conference for 2022. We're pretty excited. This has been a phenomenal conference. If you're not able to watch it all live, please go back and watch the recordings because there were some excellent sessions. So I'm going to take a minute right now and we've not been able to get Tania off of mute. So I'm going to take a minute and see if I can get some help with that. And then we'll come back to our session. Okay, so I've been assured that people are working to get Tania off of mute. So I'm been given the okay to go ahead and get our session started. So hi, my name is Pam Lynch and I work with Harm Reduction Michigan. We're a statewide organization that runs harm reduction programming in about 12 different counties throughout the lower peninsula of Michigan. And we're here to talk about housing first, and housing as a human right. So we're going to do the bios separately for people. And so I'm going to go ahead and start off with Mr. Ryan Hannon. Ryan has worked within the human services field for over 17 years, and specifically with people experiencing homelessness on the streets for over 14 years. He is the Community Engagement Officer for Goodwill Northern Michigan, as well as Safe Harbor of Grand Traverse County. And he's their technical advisor. Ryan serves on the advisory board for Traverse House Clubhouse and as Northwest Michigan Coalition to End Homelessness's Outreach and Identification Work Group Chair. Ryan is the 2014 ACLU of Northwest Michigan's Dean Robb Unsung Hero for Social Justice Award winner, the 2018 86th District Court Robert P. Griffin Award for Court Advocacy Award winner, and the 2021 City of Traverse City Human Rights Commission's Sarah Hardy Humanitarian Award winner. We love Ryan. Ryan does a really great job. And we're not the only ones that love Ryan. So the emphasis of Ryan's work is on ending homelessness in the Grand Traverse region and street outreach best practices. Welcome. Thank you, Ryan.
Thank you. Well, Ryan loves you all too. Can you guys hear me okay?
Yes.
Very good. Welcome to the session here. Housing is a human right. We certainly believe that in all the work that we do. Everyone deserves housing no matter what, and that is the emphasis of our presentation here. Do we have the slides?
I don't have the slides, but if you have the slides pulled up, Ryan, at the bottom, if you can see those 5 icons at the bottom of your screen.
I don't have the slides, so I'll just talk through them.
Okay.
Yeah, and forgive us, our moderator got switched at the last minute, so she had the slides, but we'll go with housing is a human right. Housing first is harm reduction. Disclosure, none of the participants presenting today have declared a relevant financial relationship with an ineligible company. That's a disclaimer for the conference, we must say. First, housing for people. If we could see the slides there, I have a photo of Damon Johns from Shark Tank, if y'all ever saw that. With the point of housing for people who are homeless is an investment even Damon Johns can get behind because the numbers add up, right? Housing First participants, there was a study in 2020 that showed Housing First participants spend 73% of their time in stable housing compared to 32% of those who receive treatment as usual. So Housing First means we house people first, no matter what their conditions are. They don't have to meet any preconditions of being morally straight, completely sober, mentally stable, all issues we all struggle with. Prior to this approach, people had to prove all these things before they can get housing. We know that people are successful with the Housing First model, meaning we move them into housing, then help them with their identified issues and goals that they want to work on. And the key to it is working with the people, listening to what their needs are, and being able to engage with them in a meaningful way. Housing first as an intervention paired with intensive case management or assertive community treatment. Another study showed they had the same result of success whether they had substance use disorder or not. So this, we hear all the time, a lot of times out there, that people that are have substance use disorder can't be successful, or they don't heal, or they don't get better, or they lose their housing over and over again. That happens sometimes, but with the right supports, people can remain stably housed. And the key is the right supports. We know that housing ends homelessness, but for people that need extra support, it's got to be there. And that's the biggest key. I had a very minor example here of a gentleman I helped move into an apartment. He was experiencing homelessness for about 7 years. At the time, it was, he has a medical marijuana card, and it was before the state even, made it legal to use marijuana. But the housing complex he lived in was federally funded, so there was by no means could he have marijuana. He could actually be evicted. So one of the things we did was drive around and look for areas where he would be able to use his stuff, because many people use it, right? Just because he's homeless and uses it shouldn't mean that he doesn't have access to help. So that kind of support and helping support people living in their place the way they are, the way their sense of their own being, right? Just like everybody has a right to. Um, Moving on, unpacking some myths. We know that working with people experiencing homelessness, people do not have to like us as providers as a precondition for accepting service. We can work with people no matter what. And a lot of times, what I've found is people experiencing homelessness are having a really hard time meeting their basic needs. Trying to jump through the hoops that are set up to access help is almost impossible when you're living in these conditions in fight or flight mode all the time. They don't have to like us, right? They are often very appreciative, but we help people because that's what they need help for. And that, at the end of the day, that's what we're here for. Bribes are not necessary for engagement. When we're coming along to help someone who's living out there in the woods or a tent or under a bridge, we don't have to, bring them something so they talk with us. Being genuine and actually offering the help that they need and finding out what they want is the way that works. Folks don't need to be sober. People do not need to be compliant with medical treatment. People don't have to have income in place at the time of housing. And another myth is landlords will not rent to this population. We see time and time again, we have a difficult time finding housing, but when we do, and we are able to help people get housing that are struggling with these issues, it works. People, especially when they have that support to help them, and landlords appreciate kind of a landlord liaison, if you will, if that's needed, as the housing support worker can help respond to issues should they arise. That way the landlord doesn't have to deal with it and with what their approach is. All they can do is give a citation or evict somebody. But if they have somebody they can work with and say, hey, I heard this, can you go check on it? And then they work with the person and solve it, then they don't lose their housing. What I like to share when I'm talking, for 14 years or so, I've been working with people experiencing homelessness in the streets. And a lot of times people will say things like, well, they must want to be homeless. And that couldn't be farther from the truth. There may be some situations where maybe the people don't want the help that's being provided or trying to be provided to them. Without actually talking to the people and getting feedback on what they need, and you're trying to help them and it's not what they need, of course they're not going to take it, right? So sometimes people might try to save face and be like, I want to be out here, maybe something what they say. And what really they're doing is preserving dignity. When you're the person who's experiencing homelessness and you're homeless all the time and you have to interact that way with the public, and it's hard. It's a terrible kind of place to be. So if you got someone who's actually listening to you and they may say something like that, it reinforces the myth, but they're really just trying to save face. People might say, well, it's free out here. And what's really going on is maybe shelter's not working for them, right? The shelter barriers prevent people from coming in. So they're outside. It's not like they want to be out there. We might say, I'm a survivor. What really is going on is they're still homeless and there's no way out, or they don't see a way out. Of course, they're going to be resilient and survive, but the approach isn't working for them. People might say, I can drink or drug anytime. What's really going on is maybe they can't stop using, or they can't get help because they're using. We hear sometimes, I'm tough. But really, it's scary out there. And that's just my experience. The question I want to present to the participants here, if you're working in the medical field or whatever it is, and you're interacting with people who are experiencing homelessness, I wonder, do you practice housing first in your town? Does your approach to homelessness in your community use that housing first approach rather than being punitive or trying to fix people before they can get the help? With that,
So,
I will turn it back over to you, Pam.
thank you very much, Ryan. I think you hit a lot of chords for us all. And I think what we're going to do is we're going to save questions for the discussion at the end and let everybody have their 10 minutes and then go ahead and discuss that because, we heard a lot of challenges that we identify with as you spoke them. And I saw other people's heads shaking and I think you darn near got a proposal in the chat box hitting striking chords with people that are tired of the system not recognizing what the challenges are. So I'm going to quickly read Ben's bio. Ben will go next. Ben at Asaf. Am I pronouncing that correctly, Ben?
Asaf, yeah.
Asaf, okay. Ben works as a case manager and advocate for the guest services at Pope Francis Center. Pope Francis Center is a low barrier warming shelter located in the heart of downtown Detroit, serving the underrepresented and housing insecure population of Wayne County 6 days a week. He takes great pride in his growing works as an advocate, community outreach worker, and friend to partnering organizations within the community that do similar work. Mr. Asaf believes in strong communication and cooperation between neighboring organizations. When we combine our efforts, we have a much greater chance of uplifting those we serve. We can do together what we cannot do alone.
Great. Thank you, Ryan. Thanks for kicking us off. I was a little nervous to get started, so I'm glad they called on you. You really set us up for success here. Yeah, my name is Benjamin. My guests and my friends call me Benny. I guess I'll just go ahead and describe a little bit what we do here at PFC. And so I started here about not quite a year and a half ago. And that would have been right smack dab in the middle of the darkest times of pandemic. And they were in need of somebody to fulfill a kind of a case management role, an advocacy role at that time. And I had some connections with the company and some friends who knew Father Tim, our director. And I was brought on, and I think one of the things that really helped get me in there was my love for people. I had a long history of working with folks from all over and in group home settings. And but I have a lot of lived experience as an addict myself. So I'm just shy of 3 years in recovery right now. So I bring a lot of my 12-step experience to the shelter. And I think it's incredibly valuable because many of the folks that I work with really closely are all struggling with those things and have been for many years. And I mean, I remember being shunned when I was in active use, and I remember how painful that was and humiliating that was. And it would literally prevent me from asking for help. And one of the things that I've learned through community and fellowship is that it doesn't, I often thought I had to ask for help one time, to get out of a bind, and then I could start my life over again. I like to live in a perfect world, and the truth is that I have to continue asking for help daily, and from people that I wouldn't feel I could connect with. So I bring a lot of that energy and perspective to the shelter. So I like to focus on what we do best here, and we are not funded in the typical sense by city grants and that kind of thing. So we offer a low to no barrier day shelter, warming and cooling shelter. And because of our non-traditional funding sources, mostly from private donors, we get to call the shots. And our conditions, I love bragging that we have the best meal in town. The facility is the cleanest. And I think we have some of the friendliest and most welcoming staff and volunteers. We couldn't do this without our volunteers that we have working for us every day in town. I think that we run the best show in Detroit right now, and our numbers reflect that. We get anywhere from 120 to upwards of 250, depending. We had to change locations for a little while to accommodate our guests in shutdown. So we were operating out of Cobo Hall, which is a big event center downtown in Detroit, and that was rented out to us for a couple of winters. It afforded us the space to work with people while they were distancing. But we're back in the church downtown Detroit right now, and we are open from 7 in the morning until 11 every day. We serve breakfast and lunch, and we also offer showers and laundry and some, emergency clothing and stuff like that. And we do that so well. It's what I'm really proud of, the work that we do with that. And we're trying to expand on that a little bit. And myself and another coworker do advocacy work. And we were both granted a license to HMIS, which allows us to track shelter stays in the Detroit system and any interactions or collaborations that our guests might have with caseworkers in the city or other navigators. And I have all of this information in front of me, and it can be confusing for me now, to navigate these people. And I can't even imagine living on the street where it's difficult in the first place to obtain crucial documents like ID, birth certificate, without the funds to do so, and to hold on to those things. And the unfortunate reality is that most of our guests are victims of assault. And I've met so many people at the center that obtain all those things, and then they're robbed of them the next week, and we just start over from square one. And so what we do is, what I like to do, and some of my best days are when I'm able to fill people in on things that they might be confused about in that process, or they might think that they've been forgotten about, and when the reality is that they don't have a phone that's active anymore, and nobody knows where to find them. And I can see that case notes are being made, that contact is trying to be made, but they don't have any way to find them. And then I can put a note in there that this person comes into the shelter daily, and I have a really good relationship with them, and I can make a simple phone call, send an email, and reconnect somebody with a navigator, and try to get the ball rolling again. And my limited experience is about, like I said, about a year and a half in this field, and I'm not going to lie and say that it hasn't been difficult to wrap my head around how around the instability of the housing market right now for our guests. So I'd say the thing that I focus on most is trying to reconnect people with navigators and caseworkers from the city. And at the very least, I can be the voice and maybe the face, if that's, for applying for places, if you've got Section 8 or if you've got a voucher from the city. I'll sign documents, I'll fill out applications with you, and I'll meet you wherever you're at, and do my very best to see you get, into the next step of life, for our guests. So beyond that, I'm really grateful to be asked to do this. This is cool. This is the first time I've ever been asked to do something like this. So yeah, I guess that's all I've got. Was that about 10 minutes?
That's perfect, Benny. Thank you. So this sounds like a great place, Pope Francis Center, and I'm excited because our next guest speaker is Tania Denard, who also is a worker at the Pope Francis Center. I'll quickly read the bio I have here for you, Tania. Thanks. Tania Denard is currently working as the program director at the Pope Francis Center, Detroit. Sounds like you're doing a good job. Detroit's premier warming center for those suffering from housing and food insecurity. After working in the child welfare system and helping children and families for 16 years, she transitioned to working with adults with cognitive and developmental disabilities, and it ultimately led her to work with the homeless population. Ms. Denard holds a Bachelor's of Arts from Michigan State University and 2 certifications in diversity, equity, and inclusion, one from Cornell and one from the University of South Florida. Thank you, Tania, for being here. Yes, maybe a little louder. Yeah, I don't know if your connection is solid. It's kind of choppy. It's coming in and out. Maybe if you turn your camera off, maybe it'll take your sound. Somebody suggested that. I don't know if that'll work, but can you say something now and see if we can hear you? I'm not getting any sound.
Oh, there's.
Okay, now I can hear you. Now I can, yes.
I'm that is one.
Yeah, I'm not sure why the mic icon is flashing on and off. Okay.
Maybe we could take some questions, and since my connection seems stable, I could.
Okay, well, maybe, or if you'd like, I can move on to Randy, who is our next presenter.
Oh, I'm
Randy
sorry.
and
I didn't realize it was someone else.
Oh, it's okay. Randy and I are sharing a screen here. Tania, if you get to a point where you feel like you've got a solid connection that's not choppy, we can bring you back in. So I don't know what this is about here. Okay. Wow, it's really jumping all over the place now. I'll just keep talking. Can you guys hear me? What is going on with this? All right, can you guys hear me? Did I lose signal? Okay, you can hear me. All right, I'm getting messages in the chat that you can hear me. So I'm here with Randy, who is a strong advocate for women's rights and for drug user health, and for helping people work towards the end of homelessness. So I'll let Randy share.
I've been homeless for probably better part of 10 years, maybe 2.5, 3 years in housing. There's so many struggles that I face on a daily basis that have to do with my location, with communication, my addiction. It's like one thing after another pops up, and it makes it hard to do everything, do anything. I mean, like Ben said, I have to reobtain a bunch of documents just to be able to get anywhere. Again, for, several times I've worked with Ryan for the past probably 5 years. I have to get all my documents again. And I was just in housing, and I lost my housing due to a domestic situation that I was in. And right as I was trying to get into rehab, my house got raided. So then my housing was completely gone. And I was trying to, move forward and all that. I try to, the best I can, to work with everybody, on my housing situation and on my addiction and everything. But, one thing after another, it just pops up. And I seem to, no matter how hard I try, I just don't really get that far. I mean, the expectations that people have on me because of my homelessness, my addiction, and everything else, it kind of, it sets me up for failure. And then going into legal systems, that is even worse. I mean, I lost my housing. I didn't have many supports like where I was at anyways, but I lost my housing. So now I moved an hour away from there. So the courts want me to do drug tests, and I have to see a Suboxone doctor, and I have no way to get to these places. I don't even have a phone to talk to them. I don't have people really to give me rides from an hour away. I couldn't even call those rides if I did. So the housing first approach, I think, is a really great idea because you have to. What's the point of like getting better, getting your shit together? Sorry.
Oh no, you're okay with this group, I think.
What's the point when you don't have a place to come home to, somewhere to be safe after everything? Like, you can't expect people to just get it all together with nothing. Now, I've been trying to go to rehab for a couple months, and now if I went, when I was sober, what would I do after that? And then society wants me to meet a whole bunch of expectations I don't think I can do yet. Like, I have been on drugs for 15 years, and to say in 3 to 5 days you want me to be up and running like everybody else is it's a lot. It's a lot to put on somebody. My husband actually just relapsed because of expectations. He was in jail and then treatment, and then within a week of being out, everybody wanted him to get a job and start working on his license and have everything, trying to get housing, and it doesn't really work like that. So he ended up relapsing and is back on the streets. A lot of us come into this situation and we don't have supports. I mean, we come in by ourselves and pretty much with what we have on, that's all we have. But I mean, there are a lot of great people that do work in the field, so that's good. But I think I've been out, and the past 2 winters I spent in the tent, and some of that was my choice, but basically it's just because I don't want to be around a whole bunch of people all the time. And it's hard. It's really, really hard. It's hard for a lot of people. My addiction, what that plays in my homelessness, I've been trying to get clean, but it's a process. It's hard for me to, I don't know. I guess basically the hardest part is just getting somewhere with nothing.
I would imagine that it's really hard, especially when you have to constantly, like Benjamin had mentioned, start over. Like everything you accomplished last week is now like you just had the rug yanked out from under you again, and like you shared, you and your partner had finally after, and like other communities, some of these communities that are resort communities, like along Lake Michigan and other places, it's like an additional layer of difficulty because the Airbnb market is off the hook. Like these places, when people would come and be excited, my clients at the community mental health facility where I used to work, they would be excited because they got a voucher. And it was like, having a voucher here doesn't mean anything because nobody takes them, because they can all, like rent their houses for Airbnb in the summertime for $2,000 a week. And so nobody's taking vouchers. And so it just adds an extra layer to the homelessness problem that is really difficult. And, but, you know, so you guys finally get a trailer, and then because of this infighting with, you know, in-laws, somebody who is angry about the situation calls, you know, the narcotics unit, and next thing you know, there's a raid, and the only person there at that point is you. And so now you're, you know, Randy's got a whole bunch of new charges in a court system that is certainly not set up to help, you know. And then just now, but in preparation for this talk, Randy shared with me that because of a previous charge that was a mental health breakdown, that in the process of this mental health breakdown, she gets arrested and gets a drug charge as a result of the mental health breakdown. Like, how that's an outcome that anybody thinks is going to work for somebody in that situation is pure insanity. Like, things need to change on a drastic level in a systemic way. This is, you know, just layering more problems on top of somebody who's already struggling just to make it day by day as it is. So, and I know I'm preaching to the choir here. So if we want, we can do you have anything else you want to add at this point, Randy, or do you want us to go ahead and take questions?
Questions.
So we can go ahead into the questions section of the discussion. I know, so you had asked that question, Ryan, is, you know, how many people out here have housing first models in their communities?
I did.
And yeah, I see Nancy in Kalamazoo mentions that, you know, they're sometimes moving homeless camps, the location of homeless camps from place to place in that community. Somebody else has made the comment that, you know, a criminal sexual conduct history has also been a huge barrier for clients. And, you know, I remind my 16-year-old, like, peeing in an alleyway can get you a criminal sexual conduct charge. You know, it doesn't have to be a pure violation or rape in order to get a criminal conduct charge in our society at this point. You know, so this over criminalization of things that 20 years ago, you know, I don't know how many criminal sexual conduct charges they were passing out for peeing in an alley 20 years ago. But I think we have taken things to an extreme on the criminalization of human behavior. And, you know, we've ended up in a big hot mess as a result of it.
And I think we're seeing the criminalization of homelessness increase. I think the pandemic has put a lot of pressure on a lot of people, but it's also really kind of unearthed the unsheltered homelessness population where it could be more hidden before. It's out in the open a lot more, at least around here. And some municipalities take a wrong approach and they start criminalizing homelessness and citing camps or moving camps. And that doesn't work. It doesn't work at all. And it's really, especially during the pandemic, I know the CDC recommended to not shut down any camps for a time. And I'm not sure that recommendation's been lifted yet. But I know, you know, even pandemic or no pandemic, forcing folks to move when they have nowhere else to go doesn't help at all. It only, one, deteriorates the more the spirit of people who are just trying to get by. It also makes it more difficult for street outreach teams to connect to people. People lose their belongings. And it's a lot of effort and resources communities providing to try to get rid of people who are homeless, but it doesn't even accomplish the goal. It just makes it more expensive and take more time when we really got to start pouring more into housing resources. And I know you talked about tourism areas, Pam. We see a lot of Michigan is tourism, and we certainly is good for our economy, but it really starts to crunch the rental market that was already tough. So what kind of policies or measures can we put in place or advocate for to preserve low-income housing that's there, promote more units, things like homeless preference, and ways for people to use their vouchers or other programs they need, or that sort of thing. So we can't give up on this housing first approach. People may say, us as advocates and providers are like housing first works, and we're doing that, yet the public still sees homeless camps. In their mind, they don't think it works. When it does for the person that's got it and the supports are accurate, we
Well,
can't
I
give up.
honestly, sometimes I think it may appear even, we don't really focus on homelessness in our agency. We have a lot of homeless that access our services, but sometimes in the whole grand picture of addiction, I think parties on the outside, they look in and they go, oh, well, it's not really working. And they don't have a good perspective on what it would look like if our services weren't there. Like they can go, well, there's still homeless camps, so it must not be working. Well, it's just that there's not enough resources for all of the things that need to be happening. Because I can tell you that if our organizations, the organizations that have shared on this conference for the last 3 days, we're not distributing Narcan or naloxone to the extent that we are, the overdose death rate would probably be close to double of what it is at this point in the state of Michigan, because I can tell you that, the University of Michigan has a running tally on, emergency responses to overdose. And it's live data that you can log into their system and watch how that's updated. And that data doesn't include any of our data. And, we've done I think we did around 60,000 doses of naloxone last year. So if we're distributing that many doses of naloxone and we're capturing a certain number of overdose reversals, those are not being captured by the system in any way, shape, or form. I mean, for our syringe service program, that data, what we distribute is being captured in the syringe service program. But to my knowledge, none of that work in naloxone distribution and none of that work in the reversals that are reported to us, none of that is being captured. And so the overdose deaths or the overdoses that are happening where people are not dying and are not being picked up by EMTs, that's not even making it into the numbers. And so, so again, it may appear from the outside as though we're not doing enough or what we're doing isn't having much of an impact. But I can tell you it would look really different if we all weren't doing the things that we're doing. Like the work that we do with Goodwill, we're really excited to partner with Ryan here in Grand Traverse County and Benjamin. It sounds like our people in Southeast Michigan need to work with you guys because you guys sound like a wonderful partner in Wayne County. And, we have a lot of access and share resources with a lot of the homeless population because of your organization, Ryan, and we're grateful for that because it keeps people alive. And it gives people choices that they may not otherwise have.
I would say it only works because of your approach, non-judgmental, there for the people. You do what you say you're going to do. You don't promise things you can't do. Sure, we have a great partnership, but even that wouldn't work if it wasn't for the approach you guys use. So we really appreciate that. And we talk about all these deaths that are prevented that don't get counted. We feel the effects. I had I'll back up a little bit, stories and connecting to where people, the public or the providers or the decision makers and stakeholders, if they can connect and kind of relate to the people, some sort of see themselves in people or see their family members in people, that really helps to hit it home. So telling the stories is good, but I'll tell a story about a gentleman that I've worked with on and off for many years, that he may have a place to stay for a while, then he's homeless on the streets again, and his significant other died of an overdose while he wasn't at a place. They were staying at a place that was someone's house that was it was a drug house is really what it was, and he had been staying there for a few months. He was out accessing resources for income and came home, and his partner was laying there dead. And the homeowner, or I don't know if it was a renter or whatever it was, kind of like was mocking this gentleman for his significant other that passed away. And so he just left the place. Now he's got nowhere to go on the street. So we see how these issues intersect with each other.
Absolutely. They intersect with each other. Just one of our workers did a little kind of secret shopper thing the other day and went by the health department and asked about Narcan kits and asked about syringes and was commenting on how, the body language and the facial expressions and the people that ran to look at her, oh, somebody's here asking about needles. Somebody's here asking about Narcan kits, but so we have to continue to work on those stigma issues in our partner organizations,
And that's a place that's, meant to be a helpful thing. So that's like what we talked about in the beginning was, helping and being helpers, and how our approach can actually hurt people and actually prevent them from accessing the help. We have to ask ourselves, why are we here?
Right. It's, it's just a good example. I've had the experience of working with a lot of different doctors who work with people who have addiction, and hearing office staff treat people with addiction in a snarky way. And, I've had to stop people and say, hey, time out. Pretty sure you make a really nice living and you've got really good health insurance and you have a great job with all of these cushy benefits. And guess what? That's all because of people like me and our disease. And so I think it's time people have some perspective on the fact that many people wouldn't be in jobs where they've got great benefits if it wasn't for people with mental health and addiction. And so we need a little more perspective on that. Like, as we know with homelessness, most of us are one paycheck away from being homeless, and so it's just, really important for us to continue to remind ourselves and all of the entities along this continuum in the service system that we're all a part of, although we may have done a training 2 years ago, that doesn't mean that there hasn't been turnover, and that doesn't mean there don't need to be constant reminders about the fact that stigma's still out here and it hasn't gone away. And I gotta say, I was a little surprised when this person did their little secret shopping mission. I was a little surprised that it went as roughly as it did, and a little disappointed. So it's just a lesson to us to, stay on it.
Yeah, I'm glad that you did that and discovered a opportunity to create more education. And our providers, I can't remember the audience here and that's attending this conference. It's medical providers, right? Or is it all?
Probably not so many medical providers, but I think there is some nursing continuing education, social work continuing education, addiction professional continuing education. And then there's a large portion of peer recovery supports and people working in all facets of any place where the helping system might cross over with people with addiction. It was
this
open
is great. It's our jobs to figure out what it is that's going to help the people. And I found asking them and listening and then implementing that change within our organizations or our sphere of influence works. It's helpful. We have to figure that out. That is our job. We can't just go day to day like you were talking about, Pam, with the doctors and going on. Sure, there's billing and people get paid to do it, but if we're not affecting change, then it's really wasteful. We have to figure out what it is and what it takes to help the people, and that starts with listening and understanding.
One of the things that we've been doing, and maybe I can touch on something that Tania may have wanted to speak on a little bit, was that we provide space in the shelter, clinic space for providers outside of our building. Detroit Recovery Project is one of them. Street medics. We have a few different street medicine, street outreach groups that come on different days and We also HIV testing and just try to make this as simple as possible. I think, you know, that's free to reconnect people with providers. And that's one of the, just in is to provide those things in-house as best we can.
Yes.
To me, it's
Access to job
issue.
training. Can you hear me? Yes.
Yeah.
Yes.
Yeah.
Oh, great. So yes,
Yeah.
thank you so much. So yes, we provide different days. We have clinics that come in, like access to jobs, job training, so that people can get job skills if they're interested. And we also have somebody that comes in to help enroll you in your health plan. We allow people to get their mail there, so that way it kind of solves one of the barriers of not having a physical address. We also have it where somebody can help them with mental health services, substance abuse services. I mean, we really are trying to be a one-stop shop so that people don't have to wonder where they have to go, or if they come see us daily, because so many people do. It's one of those things where we can say, okay, well, just keep coming here, and on one of these days you will run into what you're looking for. We have a service here for you, and if we don't have that service here, we have a way to connect you, or hopefully bring that service in-house where we can, make it easier for you to get the services and help that you need. Housing first, as you guys, housing first is great, but once we get people housed, we see so much recidivism with homelessness, because all of the other services, all the other things you need to sustain housing are really hard to keep if you don't have someone following up. You don't have a caseworker checking up on you, or making sure that you still have access to the substance abuse services that you had before, or have at all. So we're really trying to be holistic in that approach, and not only help people find housing, but help people find the help and the services they need, so that they can continue and sustain housing if they do indeed get matched with housing. Because we do have some people that get matched. It's just that they'll walk away from it because they, things happen, things come up, and they still need help. So we're really just trying to make sure that we treat the entire person, and not just simply try to find housing for them.
There she is.
Thank you, Tania. I'm glad you were able to pop back in. Benjamin, go ahead.
No problem.
For connecting with us and everything. No, I just see that the lives that our guests lead, they often come from a place of trauma anyway, and any prolonged period of time, whether that be using or housing insecure, if you weren't traumatized before, you surely are after you've spent some time on the street. And I don't even want to count how many people that I've connected with, I've gotten really close to at our shelter, that they finally get their keys, and it's really like the breakout moment, they've been waiting for the past 10 years, and they can't, they find themselves there, all alone in that place, without the connection to resources in the community that we all need. And the choice is often to go back out. And kind of like what Tania was saying, I'm just happy that we can provide a place where they can come back to without judgment. And if that's the best we can do, I'm okay with that, is to meet people with a smile and bring them back in to our center, and start over again, meet them patiently. And because I absolutely understand what brings most people there. And I was there myself. And I'm not afraid to admit that it's my privilege, as a white man, that allowed me to step up relatively quickly. And I just want to afford people, something, a chance, at life. So.
I think with the right supports and being, the right supports and getting housing, it would be a lot more successful for people that are having any problems with their addiction, with their mental health, and everything else. And the stigma kind of makes it hard on people too. Because, like, for me, I want help, but sometimes I can't tell people what I actually really need help with, what the immediate problems are for me to actually get anywhere. So, and yeah, it's more about supports, I think. Like, once you're in housing, and then the right supports to be able to get more of your goals done more.
Well, and I'm thinking, Randy, about this situation like recently where you guys got that trailer. If we can work towards changing the perspective, because I believe that, Ryan, if you and I sat down and talked to, I'm not sure about the county sheriff, but we'd like to get to a place where Trevor's narcotics team could have some perspective on just what they do to somebody's life when they've worked that long to get housing, and then some pissed off family member just calls in, and next thing you know, the housing's gone a month later, right? And I believe that if we work hard enough as providers together, that we might be able to at least get an ear with the police to start looking at, like, okay, what's our long-term goal here, and how do we get there? I believe that the police want to believe that they want to help people. At least I think there are some people in the police forces that feel like they want to help people, and that got into that because they wanted to help their community and they wanted to help some people. Not everybody, but I believe there are some police that have that perspective. And I think if we can work with them to help them to see that in the long run, when you just like throw another 20 charges at somebody to see what will stick, and now you've set them back, and because of previous charges that came with the mental health, that now they've got like a much taller mountain to have to climb. And I think that connecting the dots for people is sometimes also maybe what we have to look at is the bigger system, and how I don't think that people are always thinking about what the long-term outcomes. I remember one time we had a worker who was talking about being reversed with Narcan, and he was talking to a television journalist, and the journalist was like, well, why wouldn't you call the police if somebody's about to die? Why wouldn't you call 911? And we were talking about how a lot of people don't call 911 because they have warrants. And so this guy, like, explaining to this journalist that calling 911 to save somebody's life isn't the end of the story. That when you've got warrants and you've got previous drug charges and you might be in housing, but now you're going to lose your housing. If you had housing, you're probably going to lose it because of that new charge, and that all these things pile up to a point that it makes it nearly impossible for people to get out of those situations, or it takes them decades, and I don't think that a lot of parties along the entire continuum are always thinking about what the bigger picture is and what leads to what, and how people get to a place where it's nearly impossible for them to try to dig their way out of a situation.
And then another piece of it is housing policy, right? Just because in this scenario there was a raid, charges are still pending, right? It's not completely gone through the whole process yet you're still lost your place, right? Should there be better policy to protect people? Just because the police show up at their house doesn't mean they should lose their house. And that is something that happens all over the country. And the kind of broad range public housing authorities have to evict people or landlords based on just things like that. We can help put in preventable measures that way as well, but also thinking about the housing first model, and it may depend on which funding source or program someone is in, but even if they lose their place, doesn't mean they lose their support. Right now in the housing first model, in a situation like this, we would want to find another place as quickly as possible. It may not always be possible depending on like if it's like a housing choice voucher. I know the policy on that is if you lose the place, the voucher's gone. There may be some wiggle room there. I'm not exactly sure, but those are types of things. Housing first means housing first and continuing to help. Just because the actual place to live or unit is gone doesn't mean the supports should go away. And that's where, as providers in the homeless realm, need to remember and get better at that.
Mhm. Well, and then part of what happens, I was envious listening to Benjamin and Tania talk about Detroit, because I mean, it's a giant city. The square mileage, when you try to explain to somebody in Washington, D.C. or the Bronx, the square mileage of a city like Detroit, it's hard to conceptualize, but still being in a centralized like city, whereas in so many of the rural locations, there is no transportation. I mean, I remember when I used to work on East Mac and people would tell me they waited for the bus 2 hours to come to support group. That's crazy. So I'm not saying that the public bus systems in all these places work very extremely well. I'm not saying that, but at least there is one. And in so many places up here, when somebody loses housing for one reason or another, then they may end up in an adjacent county because that's where they have family, or a family has property, or a family has housing. And so then they're, camping on family's property, but they're in a different county. So then it's back to square one on the services that they qualify for because it's a different county. And so, yeah, it's this insanity of like starting over repeatedly,
I can't see the chat, so I don't know if there's more questions.
Let's see here. Just a lot of comments about, more sober / transitional housing. One of the comments that when Randy and I were talking in preparation for today, she shared with me that she'd been in one of the women's halfway houses in Traverse City and got kicked out for having a warrant. And I'm like, that's insane. So changing some of the policies behind this stuff that within our own organizations, making sure that, because to me, when you're doing a halfway house for people with addiction, it shouldn't be surprising and it shouldn't be a policy that they get kicked out of that facility because they have charges or a warrant, so I mean, I wasn't there, but it begs the question, like, why didn't somebody work with her to take care of that warrant so that she could remain housed in that halfway house?
I've worked with people that got kicked out of a halfway house because they had a warrant, or left because they had a warrant, or because they used and froze to death out in the woods because they didn't want to go anywhere because of that warrant.
Mm-hmm. Yep. Yeah. It's tragic. We had, a couple situations where, and it's traumatic, like what we've talked about here, when people have layers of trauma. And like you said, Benjamin, like give some people time out on the street. If they didn't have mental health and trauma before, now they're going to for sure. And then, you take sexual violence and you add that, which women, I mean, men experience that also, but add the challenges of that into being homeless and on the streets and the trauma. And it's no surprise that people are often not comfortable in a group home setting or not comfortable in a shelter setting where there are a lot of other people. And so that, is just additional challenges. But I am getting a message that